Hi everyone, and welcome back to Congestive Heart Failure Workshop Part 2. I'm Monica, and I have Ivy with me.
Hello.
Today we're excited to go into the anatomy of heart failure, kind of picking up from last part of the series when we were talking about what exactly congestive heart failure is. So if you haven't checked that first part out, go ahead and check that video and then come back and continue Part 2 with us here. So today we're going to get into the types of heart failure. So there's essentially two types of heart failure, and then one of them can be broken down into another two types. So we have left-sided heart failure, which is when you will see fluid backing up into your lungs, and you're going to have that shortness of breath symptom. And then there's also right-sided heart failure, when you're going to have more of the swelling in your hands and feet and legs. And we're actually going to get into why you see those symptoms, because the way the heart works is actually really fascinating, and maybe understanding how this heart failure is occurring will help you grasp why your doctor's prescribing certain medications, or why it's important to change these certain aspects of a lifestyle. And then for left-sided heart failure, there's two types. There's systolic heart failure, where the left ventricle cannot contract vigorously enough. And then there's diastolic heart failure, where the left ventricle is not relaxing fully. So that's kind of a brief overview, but I'm going to get more into it to explain exactly what each of these words kind of mean and why your heart is maybe struggling to be pumping out enough blood to your body. So if we go over the blood flow within the heart, your heart is a pump, and it has four main chambers, or four rooms for blood to go into. So when the blood is coming from your body, it goes into the right side of your heart first, into this right atrium here. So it flows from your body down into the right atrium and into the right ventricle. And then it's going to be pumped out to the lungs to get oxygenated. And then from the lungs, it comes back into the left atrium and then into the left ventricle. And then it goes out to the entire body through the aorta. So with right-sided heart failure, if we look at this first, essentially what's going on is that there's an issue going on with the right side of the heart. So the blood is not flowing into the right side properly, and so you're going to get swelling in your hands or your legs, and you're going to get that edema that is typically a symptom of heart failure, because the blood is not making it into the heart properly. So that's what we call right-sided heart failure. For left-sided heart failure, this is when the blood is coming from your lungs into the left side of the heart. So if the left side is having trouble containing the blood or handling it, then you're going to get a backup of the circulation in your lungs, and you're going to have that shortness of breath symptom. So that's kind of the differentiating aspect or symptoms of left side versus right side. So if we look here, for the left-sided heart failure, there's two types specifically, and this is important because the left side of your heart is responsible for pumping out blood to the entire body. Now, your entire body is very large, all the way from the top of your head to the bottom of your feet. So it has to be a big, strong muscle that is able to pump really strongly to push that blood out to all your limbs. So if the left side is failing, then it's going to cause more symptoms. And there's two types specifically. If the left muscle, so this is the normal left ventricle, or the left, and it's also the strongest muscle in the heart. So if this muscle starts to wear down and it kind of gets stretched thin and kind of just weakens, so it's not contracting as vigorously, it's called systolic heart failure. So you can see in this image on the left here, systolic heart failure, where the left ventricle is enlarged and you can see the wall has thinned out. So when the blood comes in from the lungs into the left atrium and into the left ventricle cannot squeeze as much as it usually should to pump out to the body. Now, if we look at the diastolic heart failure, you can see the wall of the left ventricle here is more thick. So it's more stiff, and when something is super stiff, it doesn't have that same elasticity. And so with the decrease in elasticity, you're still not going to get enough contraction to pump out enough blood. So here, you're getting less blood filling into the ventricle because it's stiff and enlarged. And then in systolic heart failure, you're getting enough blood filling into the ventricle, but it's just not pumping out to the body enough. So that's essentially what the heart is. I think this is so fascinating and cool to learn about. And it's great to have this background knowledge, because I think it can help in understanding the treatment plans and other lifestyle changes that the doctor may be suggesting. So if we move forward a bit, we want to dig a little bit deeper into the ejection fraction of the heart. So essentially what that means, it's a measure of how much blood that your left ventricle can pump out to the body with each contraction. So it's essentially the percentage of the amount of that blood that's pumped out compared to the amount of blood that's still in the heart chamber, in the left ventricle specifically. So that percentage can actually be measured through an echocardiogram, and the doctor can then go ahead and use it as a tool to further diagnose what type of heart failure you have. So there's two things. There's a preserved ejection fraction, which is also like the diastolic heart failure. So we just talked about the diastolic, and if you recall really quickly, that's when the ventricle is not relaxing enough because the heart muscle has become stiff. So that's called preserved. For reduced ejection fraction, that's the systolic heart failure, and that's when the left ventricle has thinned and weakened out the muscle, and so it's not pumping out enough blood to the body. So the percentages that we typically look at are if you have a 50 to 70% ejection fraction, then that is considered normal. If you have an ejection fraction between 41 to 49%, then it's kind of in the orange zone, and we probably want to take a look further into what is the cause of it. And if it's less than 40%, then it's most likely an indication of heart failure. So this is something, one of the tools that the doctor can use to make the diagnosis. And then there's also another really interesting tool. It's actually a blood test. And the blood test is for measuring brain natriuretic peptide, also known as BNP. This may sound familiar if you've ever had to go and get a BNP blood test done, or maybe you've had to get a NT-proBNP blood test done. So essentially, in the bloodstream, when your heart is overworking itself, your body releases this peptide called BNP, and it basically indicates that your heart is working harder than it usually needs to. So if you have the BNP blood test done, and you get results that are less than 100 picograms per milliliter or less than 200 picograms per milliliter kidney failure, then that's considered normal. And it doesn't necessarily completely rule out heart failure, but it does lead us, it does suggest that you may not be in the later stages of heart failure. But the interesting thing here with this BNP test is that these numbers can vary a lot, and there's still a lot of research going on because it depends on your age, your height, your biological sex, and so many other factors. If you have other things like diabetes or kidney failure, all of these will change the numbers. So it's really a bigger picture type of diagnosis where the doctor looks at several factors. But I think this blood test is very neat because it's also currently used in a clinical trial that's going on at the clinic for heart failure specifically. And it's definitely a blood test that's being used more often. We'll look at the elevated levels. So if you have more than 300 picograms per milliliter and you're between the ages of 50 to 75, this number could indicate that you have blood failure. But again, just a reminder, it does vary with conditions, with different conditions that you might have. So you may be wondering why is this not a standardized blood test? Like, when we go to get our blood work done, it's not just a regular checked mark box because it actually costs $70 to get this blood test done in Ontario. So actually the medical field is in the process of figuring out how important this blood test is in terms of its efficacy in diagnosing heart failure, or in general how useful it is for doctors to determine if this is like a cost beneficial aspect to give to the public for free, or but if the doctor does recommend to get it done, it's definitely very useful for the diagnosis process. Another blood test that's similar to it is the NT-proBNP. So this is just kind of a subpeptide of the BNP. So it's still measuring and looking for the elevated numbers, but the numbers are slightly different with this blood test. So less than 125 picograms per milliliter if you're up to 74 years of age, or less than 450 if you're older than 75 years old. These are considered normal levels, again with the caveat that it depends on your overall condition. And elevated numbers that we would typically be a bit concerned about, maybe 450 picograms per milliliter if you're under 50, or higher than 900 if you're over 50. Now, these numbers could definitely change a bit, plus or minus a few hundred depending on what research article and stats you're looking at, but these are some averages that we can go off of for now.
Yeah, and so the reason why some of these diagnostic tests are so important is because there are actually a lot of cardiac causes of dyspnea or shortness of breath that can actually mimic HFpEF or preserved ejection fraction. And so there are a lot of causes for SOB that aren't actually heart failure. So although we focused a lot on SOB and heart failure for this presentation or this series, just know that there are a lot of other diseases that can present very similarly. And we won't get into what all of these are, but they're important to consult a doctor to determine exactly what your condition is. So a diagnostic test for heart failure with a preserved ejection fraction is this HFpEF score. And we'll quickly run through it and what these mean. So HFpEF is this acronym up here. It's heavy and hypertensive. So heavy is if the patient has a body mass index or a BMI of over 30 kilograms per meter squared, then they would receive 2 points on the score. If the patient is taking 2 or more antihypertensive medications, they'll receive 1 point. For F, that stands for atrial fibrillation. And so if you have paroxysmal or persistent atrial fibrillation, you get 3 points. The P stands for pulmonary hypertension. So if you have an echocardiogram and your pulmonary aortic systolic pressure is above 35 milligrams mercury, you get 1 point. E is for elder. So if the patient is over 60 years old, they get 1 point. And then F is for filling pressure. So this is another score that the doctor can determine from a patient's echocardiogram. And if that score is over 9, then you get another point. So if you notice, all of these factors from the acronym are actually factors that increase the chance of a positive diagnostic test for heart failure with a preserved ejection fraction. And if we add up the points, you can see that the HFpEF score can be between 0 and 9. And so if you have 0 or 1, the probability of having a positive diagnostic test is close to 0. So you don't have to worry about having any sort of heart failure with a preserved ejection fraction. But near to the 7, 8, 9 range, you can see that the probability of HFpEF is 0.95 or 95%. So the higher your score is, the more probability you have of having heart failure with preserved ejection fraction.
Yeah, and so you can see here that there are lots of tools and diagnostic methods that can be used to determine the, first off, if heart failure is present, and also the specific type of heart failure that you have, because as you've heard here, there are different types, and depending on the type, the treatment and the medications and management style will differ. And so that's why there's very in-depth different methods of getting to that diagnosis. Now, this may sound like a bit overwhelming, or perhaps it's a lot of information, but don't worry, because there are ways to manage this, and that's gonna be the main topic of our part 3 of the congestive heart failure workshop. Determining what are the appropriate medications, what are the right lifestyle changes to make, and how to still have a good quality of life even though you may be diagnosed with heart failure. So just to summarize today what we went through, we discussed what left-sided heart failure is, we talked about right-sided heart failure, and we also discussed the blood flow in the heart, so the 4 chambers of the heart, and how the left side is the bigger, more stronger side because it pumps to the body, and the right side is the side that takes the blood from the body to send it into the lungs to be oxygenated. We also talked about BNP and NT-proBNP levels blood tests, and we talked about this HFpEF score that can be used as a diagnostic tool. And we also discussed that although you may have symptoms of shortness of breath, there are also other potential diagnoses, so make sure to consult with your doctor. But overall, we hope that you enjoyed this workshop, and we're looking forward to seeing you in part 3. Thank you for joining us, and we hope that you're staying safe and well. Bye for now.